Week in Review on CJDC. CJDC TV.
Welcome to Week in Review. I'm Hugh Smith, and here are your top Peace Region stories from the past week. The BC Coroner's Service has identified the body of a man who was involved in a standoff with the RCMP in Charlie Lake last Sunday. 33-year-old Mark Dolosky was found dead in this home on Rindrock Drive after a domestic dispute was reported earlier in the day. The police say a woman had managed to escape, but Dolosky and his 2-year-old son were still inside. The RCMP attempted to reach him, but were unsuccessful. Officers entered the home around 10:30 last Sunday night and found him dead. The 2-year-old boy was unharmed. The BC Coroner's Service and the Independent Investigations Office continue to investigate the death. After 4 years of negotiations, the City of Fort St. John and BC Hydro have come to an agreement on various aspects in relation to the construction of the Site C Dam. Wednesday night was the first of 3 community meetings the city hosted about the contract, and residents came ready with questions and comments for council. CJDC's Carissa Wilson reports.
The Community Measures Agreement again.
A draft Community Measures Agreement has been reached between the City of Fort St. John and BC Hydro in relation to the construction of the Site C Dam.
The only way that we would have been able to get a Community Measures Agreement is to go to the community and understand from their perspective what the impacts were going to be.
Ackerman presented the legally binding agreement to the community Wednesday evening, and one feature of it is that BC Hydro will give $1 million per year to the city during the dam's construction.
We have done a facilities review, so we know that there are facilities that will be needed. So we've decided to put the money into a reserve fund so that we decrease the debt load on taxpayers when those facilities are needed.
Other features of the draft agreement include BC Hydro contributing $100,000 per year for 8 years to nonprofit organizations and building 50 rental housing units. BC Hydro will also fund 1 new Fort St. John RCMP officer, something that Ackerman and Council had to compromise on.
We have the agreement that if there's unforeseen issues, then we'll be able to bring this back to the dispute resolution process.
Questions did arise from the public, including Jim Little, who wants BC Hydro to address his safety concerns regarding the 271 road.
We had a member killed there a couple of years ago on that narrow stretch of road, and we're concerned about somebody else getting killed on that stretch with the amount of traffic that's on there now.
Former Peace River Regional District Director Arthur Hadlin was also in attendance and commended the city for their efforts.
You've done your best, but what I see here again is Hydro's demonstrating a lack of social commitment to the whole of the Peace region.
Ackerman says one factor the city could not secure was building a bridge across the Peace River.
The bridge would have been a lasting benefit to this region, but that didn't come to fruition.
For more information about the Community Measures Agreement, visit cjdctv.com. Carissa Wilson, CJDC TV News, Fort St. John.
Medical help has arrived in the energetic city. 2 nurse practitioners have been recruited to Fort St. John to address the need for more health care providers in the city. CJDC's Carissa Wilson reports.
Wait times at Fort St. John's primary care clinic may be a little quicker now that 2 new health providers are on board. 7 nurse practitioners have been hired for the Northern Health Region and are providing primary care to communities in need.
We have 21 full-time, 4 part-time, and 5 casual nurse practitioners in the Health Authority providing primary care. We've had 2 join the team up at Fort St. John, Michael and Virginia, and both are settling into the community.
Nurse practitioners are registered nurses with a graduate level of studies, which qualifies them to work as a primary care provider across the province. This is good news for residents in Fort St. John who don't have to wait for a physician to get a basic prescription.
Residents can come see us for, many things such as colds and flus, but also for, their management of their hypertension or their diabetes. So they can see us for basically anything.
Tentonko comes from Vancouver and has a background in pediatric oncology. Working in Fort St. John was an opportunity he didn't want to pass up, and he says nurse practitioners are a good way to address the need for more health providers in the city.
Patients in general seem quite happy to see whoever they can see to work with them in meeting their health goals. So I think the experience that I've gotten is that patients are quite happy to see me.
Northern Health is still looking to recruit more nurse practitioners and physicians to combat the issue.
We do continue to work hard to recruit medical professionals up to Fort St. John, Dawson Creek, and the northeast part of our province, and we do so by highlighting the great practice opportunities that are available in those communities and healthcare work that is available, but also about the lifestyle that people can enjoy in these areas.
Tentonko says he is enjoying his time here in the energetic city and is excited for what the future holds.
I like working at Fort St. John. I love the people, the residents here. It's a young community. It's vibrant. Yeah, I'm just looking forward to spending some time up here.
Carissa Wilson, CJDC TV News, Fort St. John.
We're going to take a quick break. We'll be back in just a moment with the Peace Country's top stories. Stay with us.
Week in Review. We'll be right back. CJDC TV.